thought that it would be a nice benefit or a complement to the session to have a patient give you her perspective. So I'd like to introduce Melissa Adams. Melissa is a patient of mine. She just told me that her surgery was 7 years ago, and I have a hard time believing that, because she doesn't look any different now than she did 7 years ago. But Melissa is here to share her personal story about breast cancer and hereditary breast cancer. So please welcome Melissa.
Thank you. Before I actually start, I do have to say that I was very blessed to have Dr. Arndt as my breast surgeon throughout this process, and have highly recommended her to many other people. So I feel very honored that she was able to introduce me today, and really I feel like was a big part in saving my life. So, so I'm going to talk to you a little bit today. As you can see in the pamphlet, the whole premise of this is from the eyes of a BRCA patient living with a BRCA mutation. All of my life, I thought that having more letters associated with my name would define who I was. The more letters, the more successful I would be, the happier I would be, and hopefully the wealthier I would be. I set out on a quest of getting all the letters I could. I obtained a BA, Bachelor of Arts, an MED, Master's of Education, an EDS, Educational Specialist, and a CBIS, Certified Brain Injury Specialist. I also have a graduate certificate of study in brain injury, though there aren't any specific letters associated with that. I have even dreamt that one day I may have the letters PhD or even PsyD associated with my name. And that would be pretty cool. When I was 31, I learned that I had 4 more letters associated with my name, but I didn't have to study, write papers, or pay thousands of dollars to get these 4 letters. I didn't realize that all the letters associated with my name, these 4 carried the most weight and would have the most impact upon my life. My new letters were BRCA. And in case you are not familiar with what that really stands for, because really, cancer's an asshole. I quickly realized that these new letters would not help me to achieve success, or wealth, or even happiness. But what I did figure out is that they would have a huge implication on my life, and actually what would be the fight for my life. To give you some background knowledge, I was diagnosed with genetic breast cancer at the age of 31 in March 2007. I was completely unaware that someone my age could even get breast cancer and had never heard of this genetic mutation, BRCA. As if hearing that you have cancer isn't harsh enough of a blow, I learned that this BRCA mutation came from an estranged biological father, who, by the way, has never battled cancer himself. That was truly one of the harshest blows. I remember the phone call with Darcy just like it was yesterday. I laughed and told her that it just confirmed that I'm a teenage mutant ninja turtle. But deep down, it cut straight through me like a knife. I must admit that this came as a bit of a shock to me, to say the least. After all, I had told the doctor that had examined the lump I found that my paternal grandmother died from ovarian cancer, that my paternal uncle was battling metastatic prostate cancer, and a paternal cousin was battling recurrence of breast cancer. But his exact words to me were, "They are too distant." I have learned that many medical professionals outside of the oncology world are under the misconception that a BRCA mutation can only be passed down from one's mother, despite the fact that we have 2 sets of genes. The BRCA had significant implications on my treatment options. Having to part with my right breast wasn't something I was prepared to do, but upon learning about the mutation and the risk of getting cancer in my left breast, I opted to have a bilateral mastectomy in hopes of reducing any future risk of breast cancer. And as I was dealing with all of that, a new conversation was starting. The need for a full pelvic sweep due to my increased risk of ovarian cancer. I was having a hard enough time wrapping my head around the fact that I would be losing both of my breasts. And there I was having a conversation about taking the rest of my female anatomy. I will admit that those conversations were like listening to Charlie Brown's teacher. Most of it was a blur. It was recommended that I have a full pelvic sweep by the time I turn 35. I will be 39 this coming July, and I'm not sure I'm ready for that surgery still. Though I have had to make some very difficult decisions based on my knowledge of the BRCA mutation, the most difficult one I have made, and still have not fully come to terms with, is the decision to not have children. I personally feel very strongly that I never want to risk the chance of passing this genetic mutation onto any child for my own selfish reasons. Of all the ways that BRCA mutation and cancer have impacted my life, it is not knowing the pure joy of bearing my own child and seeing myself in that little person that hurts me the most. For that reason, it is truly not the physical pain or the scars I worry about with having a full pelvic sweep, but it is the emotional trauma that will come with the finality of not having children. Finding out that you have cancer and a BRCA mutation as a young single woman is pretty devastating. I had thought I was too damaged, broken, and unlovable, but there was a part of me that hoped that someday someone would see beyond all of the cancer stuff and love me for me. The quick realization was that at some point I would need to explain to someone all that I had been through, my continued risk for cancer, and my decision not to have children. As if dating itself isn't hard enough. Try adding in cancer and a genetic mutation. Thoughts of how to approach the subject and when to have that discussion were often in my head. Talking about it too soon would certainly send someone running for the hills. But talking about it too far along in a relationship could also be just as detrimental. I often thought of how I would respond if somebody responded in a negative way to my situation and how I would handle that. And at times I thought I was just being selfish in hoping that someone would be okay with dating a girl that had cancer. I had been talking to and hanging out with a man for 2 months, about 2 months prior to my diagnosis. We weren't serious by any means. Initially he seemed to be okay with everything and though I didn't really include him in many of the details of what was going on, he knew I had cancer and he knew that I would be having a bilateral mastectomy with reconstruction. He seemed to be fine until I actually had my mastectomy, and then he started avoiding me like I had some highly contagious disease. Just a week after having my surgery, I happened to go to his place of employment with a friend for dinner. When he saw me, he immediately ran away. I wish I could say that this first experience hadn't left me feeling so badly, but it did. I cried, not because I wanted to be with him, but because I realized that this was likely just the first of many rejections I would face as a result of my situation. I really didn't date or attempt to date for a good while after that. About 7 months later, I happened to reconnect with a man from my past. He knew that I had cancer, had a mastectomy, had the genetic mutation, and had decided not to have children. He too seemed fine for a period of time. But after about 6 months of what I would loosely call dating, he made a comment about having children. I had a very open conversation with him about my decision and never heard from him again. I was completely shattered. Again, not because I wanted to be with him, but because I wasn't sure any man would ever be okay with all the baggage that I carried. I wasn't certain if I was emotionally going to be able to handle rejection yet again, so I just stopped dating. When I met my now husband about 7 months later, I hadn't even thought of the possibility that we would date or eventually get married. We happened to meet through a mutual friend. This mutual friend and I were doing a fundraising campaign for Gilda's Club. So the conversation about cancer and my own experience just naturally took place as we were discussing our reasons for being a part of the campaign. I was very open and honest about everything from finding the lump, the diagnosis, all of my surgeries, the genetic mutation, the estranged biological father, not having children. I didn't really have anything to lose because I wasn't looking for a date. To say that I was baffled when he asked me out on our first date would be quite the understatement. Here was a man that knew everything about my situation and yet still wanted to take the risk of being a part of my life. Third time is a charm, I guess. He will tell you, though, that he knew the first day that we met that he was going to marry me. And even though that I am now married, I would be lying if I said that I don't often think about how the BRCA mutation has impacted our marriage and may impact our lives in the future. Sometimes I have major guilt over not having children, even though my husband tells me that he's just fine without having kids. I worry about what will happen if and when the BRCA mutation decides to rear its ugly head again and wreak havoc on my body. I know without a shadow of doubt that my husband will be there every step of the way with me. But I worry about leaving him too soon in his life. I worry that I'm not doing all that I can possibly do to keep the cancer at bay, even though I eat right, exercise regularly, don't smoke, drink on very rare occasions, and stay current with my medical checkups. I think that no matter what I do, if my DNA decides it is going to go haywire on me, it will, no matter what I've done. I also worry about things like retirement and health insurance. I wonder if all the work, time, energy, and money that I invest for when I retire will be all for naught. Will I even make it to see retirement? I worry about changing jobs and having to get new health insurance. While I know that I can't be denied because of cancer as a pre-existing condition, I do believe I can still be declined for the BRCA mutation. There are so many ways that living with a BRCA mutation impacts upon one's life, and I would imagine that it is different from one person to the next. Even though I have lost so much through cancer and this mutation, I have done so much more and gained so much more. I never imagined that I would learn so much about myself, about life, and the world around me. Having the BRCA mutation has taught me to live life to the fullest and take each day as it comes. I don't know what the future holds for me. Maybe I will live to see 100, but then again, maybe I won't. I don't want to take the chance at ever looking back on my life and having to say, I wish I woulda, coulda, shoulda. In the time since my diagnosis, I have been skydiving 3 times. I have done a significant amount of traveling. I started dragon boating with the local team, Pink Steel. I have modeled for a number of breast cancer projects. I have been in a documentary. I became a peer mentor for McGee and the American Cancer Society. I have volunteered for the National Ovarian Cancer Coalition and Gilda's Club. I speak to first-year medical students at Pitt every year. I have been the keynote speaker at the Susan G. Komen Survivor Luncheon in Shreveport, Louisiana. And I started my own charity called Cancer Fighting Princess, with the mission of helping to support the social, emotional, and physical needs of young women through their cancer journey. One of our big programs is our Thanksgiving Day program, where we provide fully prepared Thanksgiving dinners to survivors. I have also started running, and in 15 days, alongside several friends and my amazing and awesome medical oncologist, I will be running the Disney Princess Half Marathon. In closing, I would like to offer you some thoughts on things to remember as you encounter those faced with hereditary cancers. Treat the person, not just the diagnosis. People do identify with their sexuality. Every decision is an emotional decision. Nothing is absolute. Be honest, but be gentle. Treat with your mind, but listen with your heart. And remember that living is more than just being alive. What I want to leave with you today is one of my favorite quotes. It is not what they take away from you that counts. It's what you do with what you have left. Herbert Humphrey. Thank you.
So Melissa is open to any questions from the audience. You silenced everybody.
Yes. Nothing is a good thing or nothing, yes.
What advice would you give to medical professionals as, you know, the top 5 things you would not say to a VRC patient carrier, or something that we constantly say the wrong way, or that you'd like us to treat differently?
That's a great question.
That is a great question. Wow. And if I can actually kind of piggyback off that a little bit, I think one of my biggest pet peeves, and I don't know if anybody here really is in the position of doing this, but when I got my initial diagnosis of breast cancer, they called me on the phone and I was at work. I did not want to receive that information at work. I had actually called 2 days ahead of time, asked to meet with the gynecologist that had referred me for all the assessments. My actual gynecologist was overseas somewhere doing something amazing, but I didn't have that option. They called me on the phone and they told me, you know, right then and there that I had breast cancer. And I will tell you that that was probably the most devastating thing that they could have done to me. So I will just kind of throw that out there to you all if that's something that you can, sure, if that's something, you know, that you have any control over. Things not to say to BRCA mutation carriers. I actually had someone talking to me about my decision not to have children. And this was a medical professional, and was, I guess he really kind of minimized my whole reasoning for not wanting to have children or making the decision purposefully to not have children by comparing my situation to his situation, which was heart disease. And while, you know, heart disease can be very devastating, you know, I felt like he really wasn't listening to what I was saying. You know, I took very seriously that I have the ability to control whether or not I pass this mutation on down to a child. You know, I know that all of the science is there and it's a 50-50 chance, but you know, that 50-50 chance is way too much for me. I remember watching my mom watch me as they were wheeling me out for my surgery, and she wasn't even the one that passed this on to me, and she was just devastated. I don't know that I could have carried the weight on my shoulders, you know, if I were to pass this on to someone else. I think the other thing too is, you know, one of the things not to say is, you know, it's not a big deal. You know, everything's going to be fine. You know, the reality is that none of us have a crystal ball. We don't know what's going to happen. We don't know that everything's going to be fine. It kind of is a big deal. I mean, it is life-altering. The diagnosis itself changes your life. Add on top of that, you know, a BRCA mutation, and that is even more devastating. So I can't really think of anything else. I will, though, at like 3 a.m. when I'm sleeping or trying to sleep. Anyone else have questions? I would love to have a very candid and open conversation about, you know, my story, my background. So any questions that you can.
So the recommendation of BRCA testing came out of just your early onset of age, and you also said you had a lot of family with cancer, but the first doctor kind of didn't really pay much attention to. Is that?
Yeah. So you know, obviously I had been going to the gynecologist, you know, for a long time. I had learned probably just 2 or 3 years prior to that my grandmother had died from ovarian cancer. She had passed away when I was in like the 6th grade, and all that time I had no idea.
It was female cancer.
Right. You know, and then my uncle, I knew, had the prostate cancer, and then also my cousin had the breast cancer. And so when I was telling him, you know, I shared that information with him, he really just kind of fluffed it off like it's, you know, not a big deal, they're too distant, not even an option. And at that point in time, I didn't really know anything about a possible connection to a genetic mutation. But I will tell you that sadly, that's not the only instance I've heard of that. I have a cousin on the paternal side of my family. She has had the genetic testing done. They refused to give her the results because her doctor will not sign off on the referral, even though I provided my nice little letter that Darcy gave me saying that there is a genetic mutation from our family. But he is very adamant that she cannot get that from her father. He is absolutely dead set on that.
I do hear plenty of that from women still to this day as far as their layperson knowledge. You know, oh, you don't need to know about that cancer because that's on my dad's side. You know, we do get a lot of that still.
Right, yeah, and quite honestly, many of the questions, many of the people that I talk to, you know, outside of the oncology world, and this is just, you know, general population, but also other doctors that aren't in that field, oh, did your mom have breast cancer? No, my mom didn't have breast cancer. Well, then how did you get it? I also have a father. You know, maybe you don't, I'm not sure, but last I checked, you know, most people have 2 parents.
So we're in Darcy's Genetics 101 this morning.
Exactly, they missed that session.
But the truth is, I mean, I know we have genetic counselors here today. If the mutation is coming from the paternal side, and if there are not many women on the paternal side, it can be very hard to identify the pattern. It can be very hard, and maybe that's where the notion comes from, that it's got to be on the mom's side. And that may be the case in
Right. Yeah, and I'm not sure. I do know that, you know, Dr. Arndt really was the person that kind of set all of that in motion. I don't, as I said, my biological father is estranged. I would say that he probably left when I was 1 or 2, so I didn't really have a relationship with his side of the family. But my mom had some information, so I found out not only those 3 people, my own knowledge, but that my great-grandmother had breast cancer, and I also have an aunt that had colon cancer. You know, so that really was what, you know, set that in motion.
Yes.
So we talked about what not to say. What would you say to a genetic counselor or to another healthcare provider? What are the things to say to a young woman who's going to be facing decisions maybe they're in their late 20s or early 30s? They find out they have a BRCA mutation. Maybe they've never had cancer, or maybe they're in a similar situation to you. What are the things that you are really grateful that you heard, or things you wish you would have heard at the time that you were given the information?
Honestly, for me personally,
Yeah.
like I said at the end, be honest, but be gentle. And I'm sorry to keep putting you on the spot here, but one of the things that I remember from one of my first meetings with Dr. Arndt was going in and telling her that I had made the decision to do a bilateral mastectomy with immediate reconstruction. And what I had said to her was, you know, in hopes of saving my life. And she very openly but gently looked at me and said, I can't make you any promises that it will. You know, and I felt like I needed that. Like, I needed to have that reality. But she did it very gently. You know, it wasn't like, well, you have this BRCA mutation, good luck with that.
Yeah.
You know, that's not to say. You know, but I think really having a very open conversation about, you know, what this means and you know, I think the statistics certainly do carry a lot of weight. but at the same time, not everybody's going to be a statistic.
Right,
You
no
know.
one individual is a
Exactly. So, while I'm sure that the data certainly does help with some decision making and all of that, it is, we have to remember that, everybody is an individual, and, the way that it's going to impact one person is going to be different from the way it impacts another, so.
I love what you said about every decision in the workshop is
It is. Thank you.
Yes, sir.
This morning we talk about, one of the speakers mentioned about the father got the daughter's check for the BRC gene, then, and then what did, without thinking about the implication on the daughters with his knowledge. And you got to know about your BRC when you were 31. Now, if you were to look back, what do you think would be the right age for you to have known about this, so that you could have lived your life differently, you could have done things differently? Do you have your opinion about what that age for a woman to know about, or any person to know about it?
I do, and I honestly feel like the earlier that they can have that information, the better off that they can be. I would have much rather preferred to have found out that I have this genetic mutation and been able to be monitored over a period of time, rather than, having that harsh blow of you have cancer, and then adding on top of it, that nice little cherry of BRCA. So I do feel like the earlier that they can get in there and get that information, and I have lots of, folks that I talk to. I have a huge following on our Facebook page for Cancer Fighting Princess, and people will frequently email me questions. Should I have my daughter tested? Should I have my son tested? When should I do that? And I always say, it's really a personal decision, but I do feel that in my situation, I wish I'd had that information before being diagnosed.
I have a question. During the debate earlier, Dr. McAuliffe was making the case for how difficult it is for BRCA carriers to have long-term screening, and sort of the screening doesn't prevent another cancer. The goal is early detection. Can you share with us the impact that ovarian cancer screening is having on your life?
Good thing Dr. Zorn's not here anymore. I love her. Trust me, I love her. But she probably is, at some points during my screening, she's probably cursed me a couple of times.
Well, because she's just, so if those of you who don't know Dr. Zorn, I think she's very proactive about encouraging patients like Melissa to have risk-reducing salpingo oophorectomy. So, there's patient-physician conflict sometimes.
And we were always very respectful of each other, quite honestly. And, I really did a lot of research. I learned these terms. I knew what a hysterectomy was, but oophorectomy, and, so I learned those kind of things. But, the ovarian cancer screenings, boy, that's one emotional roller coaster, I can tell you. So I started in January following my initial diagnosis, so that would have been January of 2008. And I've had a couple of hiccups here, I would say. And most of that started in 2011 when my CA-125 levels had doubled. So I immediately got a phone call and was told I needed to come back in, needed to get double checked. And then they found a semi-solid mass, which scared the daylights out of me because I didn't know exactly what that meant. So I was probably there every single month for the 6 months leading up to my wedding. I got married in July 2011, so the timing was impeccable. And I at this point, I still do have increased levels of CA-125, and I am very strict, although I didn't have my appointment yet. It will be in February. I was due in January. Pardon, don't tell. Although I see my doctor sitting in the corner back there. But I feel like, it has been really beneficial for me. I think the conversations are very helpful. You know, sometimes they're hard to take, but I feel like, you know, especially with Dr. Zorn, you know, the conversations that we had, you know, I think we both kind of needed that. Like, I feel like, you know, she kind of needed to see my perspective, I kind of needed to see her perspective. You know, I get that I'm putting myself at increased risk for ovarian cancer, but I'm not really quite sure that I'm ready for medical menopause either. You know, so there are just, you know, and the other things that I mentioned, which I won't talk about again, but, you know, so I think the whole ovarian cancer screening has kind of kept me on edge a little bit, you know, but it keeps it, and it keeps it fresh in my mind, whether that's a good thing or a bad thing, but it just, you know, kind of keeps me reminded that I do need to be diligent about my health, you know, that I need to have good nutrition, I need to exercise, you know, and I need to make sure that I'm having my medical checkups regularly. So I hope that answered your question. Honestly, I don't remember what it was at the time.
Any other questions? Thank you very much.
Oh, she had
Was there another one? I'm
yeah.
sorry.
I
think it was
Please,
two.
yeah.
I just had one more quick one. In your experience talking to mutation carriers that find out they have breast cancer, do they have a perception that their outcome is going to be worse with their breast cancer because of their mutation? Because we know in actuality that's not the case, that they have just as good a chance, if not better, of responding well to treatments, and that they're not higher risk of metastasizing or dying from their cancer. But what do you get?
Yes.
What's the vibe amongst carriers?
That, yeah, there is certainly the perception out there, and I will be honest that I was absolutely one of those people. You know, as soon as, and again, like I said, I remember the call with Darcy just like it was yesterday, and immediately after Darcy had called me, Dr. Arndt had called me. You know, and I remember writing in my journal that, you know, I was just handed my death sentence. You know, that this is the end. Like, I've had 31 years in this life, and I'm going to die. So, yeah, I mean, there certainly is that perception out there that, you know, the future does not look bright, you know, that they may not get through this. So I think that would also be a very important thing too is, you know, okay, so here are the statistics about, you know, how many people with BRCA mutations get cancer, but let's also talk about those that are surviving and thriving, you know, and they're living their lives, and, you know, they're just making sure that they're doing their due diligence, you know, with their medical appointments and such.